Bismillah ar-Rahman ar-Rahim. Today I'm going to discuss another interesting subject. And before we start, I want to remind those who didn't subscribe before in the channel to do subscription and to activate the alarm bell so that they can be updated by any new video. The subject that I'm going to talk about today is the role of inflammation in depression and fatigue. Most of my information today is coming from this interesting paper. It's titled The Role of Inflammation in Depression and Fatigue. This paper was published in Frontiers in Immunology in 2019, July 2019. First, to begin with, to know the size of the problem of depression worldwide, that we have to know that depression affects more than 168 million people worldwide. So you can imagine how much it affects the quality of life of such a big number of people. And actually, depression constitutes like the fifth highest global years lived with disability in general, and in high income countries it constitutes the third highest years lived with disability. And especially with depression is a very big problem affecting quality of life in patients with chronic disease like cancer and multiple sclerosis. As regards fatigue, fatigue is defined as a subjective lack of either physical or mental energy that interferes with the usual and desired activity, which is also associated with mental health symptoms such as depression and anxiety. And fatigue also is very common in chronic conditions and can have prevalence as high as 99% in cancer patients. To study the role of inflammation on depression and the relation between presence of inflammation and struggling with depression and fatigue, we have two examples. Number one, the immune-mediated disease of the central nervous system like multiple sclerosis. Number two, when using disease-modifying therapies that affect the immune system like using interferons. So both of these two groups are good models to explore this association. Cytokine-induced sickness behavior is another example that we can study the link between the immune system and psychological responses. Cytokine-induced sickness behavior is a syndrome characterized by decreased activity, depression, and loss of energy because of increasing circulating pro-inflammatory cytokines. Also, another previous studies that did meta-analysis have shown that there is increase in pro-inflammatory cytokines such as tumor necrosis factor alpha and interleukin-6 in people suffering from depression. And in other studies also, they have shown that not only interleukin-6 and tumor necrosis factor alpha, there is also increase in other inflammatory cytokines like interleukin-13, interleukin-18, interleukin-12, and interleukin-1. And those all constitute the inflammatory portion that present in patients with depression. Other studies also have shown that there is a wide variety of chemokine levels increased in patients affected by depression. And not only this evidence, there is also more that the other studies have shown that the changes in these cytokines may be also a predictive sign of future depression. There is a one longitudinal study that have showed that people with higher interleukin 6 at the age of 9 are more likely to have depression at the age of 18 in a dose-dependent manner, even after adjusting for a variety of factors. In contrast to the previous finding of increased inflammatory cytokines in patients with depression and fatigue, other studies have shown that also there is a suppression of immune responses in patients with depression. And more recent studies have shown that there are depression in patients can present by the two sides, with activation of inflammatory cytokines and also with decreased immune system, with decreased natural killer and regulatory T-cell Treg activity. So patients with depression may have both activation and suppression of the immune system. In other studies, researchers tried to find how this peripheral inflammation and increase in cytokines affect the brain and leads to suffering from depressions and other behavioral symptoms. And there was some results that showing in animal studies that tumor necrosis factor alpha caused changes in the endothelial cells constituting the blood-brain barrier. So it will result in reduced tight junction protein expression, with larger extracellular gaps, with increased permeability. All of these changes will let these peripheral inflammatory cytokines to go into the brain and result in changes like depression and fatigue. These all changes were found in some researches to disappear or decreased by using anti-inflammatory drugs. So to add more, not only the peripheral inflammation will cause disrupt or the blood-brain barrier and let inflammatory cytokines to go inside the brain and affect the brain function. Also, CNS inflammation can affect the blood-brain barrier and allowing for easier entry of both cytokines and immune cells into the brain. That's why patients with multiple sclerosis have worse or doubled psychological symptoms compared to those with other chronic disorders, because it affects the CNS, so it disrupts the blood-brain barrier, allowing the inflammatory cytokines to come from outside and increase more above the disease process in inflammation of the central nervous system. Other studies tried to discover what happened in the brain structure when there's a peripheral inflammation, or we give an immunotherapy like interferon alpha in patients with hepatitis C, and they found many changes in the brain, including changes in striatal microstructure and also in brain connectivity, brain global connectivity, and actually these changes happened as soon as 4 hours after injection of interferon alpha. So overall, we can conclude that inflammation causes disruptions in blood-brain barrier along with cellular and structural changes within the CNS that can appear very quick and very rapid. So now we can understand why there is higher rates of depression and fatigue across broad range of conditions associated with activation of the immune system, like allergies, autoimmune diseases, type 1 diabetes, multiple sclerosis, systemic LE, and rheumatoid arthritis, and even infections. And as an example, a meta-analysis study was done on systemic LE patient and showed that 30% of patients with systemic LE suffer from depression using the standard hospital anxiety and depression scale for depression. Also, other studies have shown that depression has high prevalence in patients with rheumatoid arthritis. And as I said before, the link between immune activity and depression and fatigue is not only shown in immune-related disorders, but also was shown in other studies in infections where the immune system was activated in response to infections, like in sepsis situations. And as the more evidence that about the strong relation between inflammation and depression, in other studies they found that changes in the level of immune markers have been associated with the response to antidepressant therapies like serotonin selective reuptake inhibitors and tricyclic antidepressants, and also these changes were found helpful in predicting the treatment efficacy. Not only the pharmaceutical therapies that have shown changes in inflammatory markers, but also treatment with psychotherapy and others like exercise and transcranial direct current stimulation have shown immunomodulatory effects on patients with depression. And as I said before, studies also have illustrated that the immune markers may be used to predict the treatment efficacy. Not only affected, but also it can be used to predict how much the treatment is efficient. As regards the fatigue, only few drugs were found effective in treating fatigue, and amantadine is one of them, but there is a few studies that work to see the immunomodulatory effect of anti-fatigue drugs. From all this evidence, we can conclude that there is a strong relation between the immune system and depression and fatigue, and the immune system actually plays a strong role in depression and fatigue. So the use of anti-inflammatory drugs and other treatments that may change the immune system serve as potential treatment option for depression and fatigue. Finally, I hope that you enjoyed this short, interesting video. And again, I remind you to subscribe and activate the alarming bell if you didn't before. And if you have any questions or need any discussion about other new subjects, please leave a comment and I will try to answer as soon as I can. And thank you.